My name is Dominique and I am the Chief Executive of Bluecrest Wellness. And I've now been in our business for just over a year, leading our team. Prior to this, I spent my previous 18 years working in social care. I'm proud to have led a home care business that was rated 5 stars by the CQC, which is the Care Quality Commission. The common theme through my work and my passion is making a difference to people's lives, and I really care about making that difference. So delivering service excellence and exceptional quality is at the heart of everything I do. And as I said, my enjoyment comes through that difference that we make every single day. I'm delighted to hand over to Martin, who's our Chief Medical Officer, and he'll introduce himself.
Hi, I'm Dr Martin Thornton. I'm the Chief Medical Officer at Bluecrest Wellness. I'm a GP by background. I've been a GP for the last 15 years. And my true passion is in preventative health and identifying the opportunities to prevent illness before it comes along. Today, I'm really delighted to share with you the insights of our white paper, which is called Mind the Gap. And our report draws on the results of a nationwide survey that we have commissioned in partnership with an organisation called Find Out Now. The report explores the latest views and opinions towards health and wellbeing, the changing role of the NHS, of employers and individuals in taking proactive preventative health. So Find Out Now were commissioned to survey around about 2,500 people, of which around 1,500 are in employment. So those are the results we're going to present to you today.
And I'm just going to kick off with this number. Sickness absence costs UK businesses £138 billion. That is a big number. Have a think about how this is impacting on your business. And it's not just the absence itself that causes a problem. It's the productivity gap. It's the time that you and your teams, your leadership teams, your management teams spend on managing the impact of that absence, the conversations you need to have, the return to works you need to do. If you add the analysis that you need to do, the understanding what makes the sickness as bad as it is, if you add all that time up together, it's monumental. How much of it do you think is preventable? How much of this is something you can do something about, stuff you can do something about? And how knowledgeable are you and your teams of really understanding the difference you can make? And I think the thing that really was quite stark for me, for those of you that sat in Kimberly's session this morning, when she talks about the impact of mental health and the emerging trends that we're going to see coming through our millennials and our Gen Z, we have got a problem that we need to face into. And prevention is at the heart of that. Things like diet are at the heart of that. We have an obligation to make a real difference.
So what causes sickness absence at work? So what we've looked at here is the labour force survey from the Office of National Statistics taken from 2022. And if you look at the last 4 years prior to 2022, then you can find some interesting patterns. So minor illness by far occupies the majority of sickness. So coughs and colds, diarrhea, nausea, vomiting, probably what we'd expect. If you look at mental illness and musculoskeletal problems, more or less the same amount and fairly stable. There seemed to be an uptick in respiratory conditions, so probably not to be, probably expected with what's happened with COVID. But what's interesting is if you look at what they've called the other category. So underneath other are some things like accidents and things like that, but actually a lot of it is chronic health conditions, diabetes. In addition, actually, if you look at what happens with people who have chronic health conditions, many of them suffer with the other things on that list. So people with diabetes, with COPD, with rheumatoid arthritis often get depressed. People with obesity often get depressed. They often have musculoskeletal problems. So underneath those numbers are some more interesting facts. Part of our survey, we asked people, would you hesitate to book a GP appointment if you were feeling unwell? And what's interesting is 52% of the women and 44% of the men said that they would hesitate to book an appointment with their GP. And when we asked them why would they hesitate to book an appointment with their GP, so for almost half of them it was that it was too hard to get an appointment. For 18%, for example, they said they just didn't feel sick enough. Part of our survey also showed that actually the vast majority of people are continuing to work whilst unwell. So 77% of employees are working when they're unwell, and despite 56% of them feeling just tired, feeling a little bit run down, only a third of them would take those symptoms to their GP. Well, why does that matter? Why are we talking about vague, minor symptoms? The reason is because vague symptoms often lead to serious problems. So when we ask people as part of the survey, would you go to your GP if you were just feeling a little bit unwell or run down? 71% of them said no. Well, often the early signs of cancer are just feeling tired, a little bit of weight loss. The early signs of diabetes also presents most often with tiredness, getting up to go to the loo in the middle of the night. Heart disease can often present with no symptoms at all, and in fact, there's a significant number of people that their first presentation of heart disease is sudden death. So it's really important that actually we can identify these people. This is information from the Department of Health that shows that 40% of NHS costs go on treating preventable illness. So why are we spending so much money on treating an illness when people get it? Why aren't we spending that money on preventing people getting that illness in the first place? So I'm sure many of you already know that actually lots of your employees already have long-term conditions. They're living with them. You don't have to be young to have a long-term condition. So around about 30% of 35 to 44-year-olds have at least one long-term condition. That increases to about 50% once you're in your mid-50s. And this graph shows actually how you accumulate more and more illnesses as you go through life. So many people in your workforce will be living with more than one long-term condition. That means they're often on multiple medicines. They then get all the side effects of the combination of those medicines. In addition to what it actually feels like to live with all these illnesses, it actually feels pretty depressing. So what is the underlying driver of all this, and what can we do about it? Well, actually, if you look at it, much of the stuff on this list we could probably predict. High blood pressure, high body mass index, in other words, obesity, high fasting glucose, etc. But the key thing is, it's not about being told what you need to do. It's about actually having objective metrics that show that in your own body, this is a problem and this is what you can do about it. And that's what we do.
Thank you, Martin. So what do we do at Bluecrest Wellness? Well, actually, it's pretty simple. We help people to understand what's going on inside of their bodies so that they can do something about it and can take control of the issues that are identified. Some people might need urgent attention, and if they do, we'll hold their hand on their journey. Most people don't, but most people do get some indication that they might need to take some simple actions that could have a really good impact on how they improve their health going forward. So we help people understand what's going on inside their bodies so that they can take control to live well and live confident that their health is in good shape. One of the things we've launched this year is our My Wellness app. And what that enables our customers to do, once they've had one health assessment, is take a look at what does that tell me I need to do differently about my health, put together a plan of action if that's needed. Not everybody needs to do anything differently. And then when they come back and have their follow-on health assessment the next year, or maybe a little bit longer or a little bit sooner, depending on what they find, they're able to see how the action they've taken has tangibly impacted on their results. So we have a really simple RAG rating system. If you've got a red, it's probably something you need to do something about pretty quickly. If it's an amber, it could be the sign of an emergent issue or something you could simply move with some good activity into a green. And if you're green, it's something you don't need to be worried about. So it's a really nice way of being able to see and trend your results. And people want to see what's wrong. They want to gain valuable insights. They want to know what they can do about it. And they also want to see the impact of those changes on their health and well-being. And our app enables customers to do that. And as Martin said earlier on, we as society have an obligation to take some ownership. We need to move from a society that deals with treatment of chronic conditions and issues to one where we spot the signs and symptoms of those and prevent them happening. We know that post the pandemic, health awareness has risen. It's really up there on people's agendas, and it continues to rise. People know that you have to take ownership and control your own health, and that you can no longer rely on our NHS. And that's not because they're doing a bad job. They're doing a great job in the treatment of chronic conditions, but they don't have the capacity and space to look at the things that could prevent those conditions presenting in the first place. Our survey found that health MOTs tied with private diagnosis and treatment were seen as one of the most valuable health benefits that you could offer your employees, with 70% of people rating both as very valuable or valuable. And 86% of people we asked are interested in gaining insights into their health. And the benefits are really tangible. The top benefits people saw for having health assessments, for finding out more and having peace of mind. So 61% of people said they would do it just to get peace of mind. With one in two of us having a cancer diagnosis, that's the likelihood, 1 in 2 of us getting a cancer diagnosis, that's what this gives them, is that peace of mind. And identifying any health risks early. Kimberly, I thought was super powerful earlier on. When you talk about the impact that simple things like eating greens, beans, and oily fish can have, some of these things are preventable. Diet can have a massive impact on what ends up becoming a chronic health condition if you do something about it. And while people wanted to be able to know if they were at risk of threatening diseases, that was 55%. It's still quite a significant chunk. They were also looking to identify ways in which they could improve their health. So just under 50% of people wanted to know what they could do differently or better to improve their health. And really, this is a testimonial for one of our customers. We work with Specsavers. We've been working with them now for about 2 years. We work with lots of different corporate companies, and they have a whole workforce solution. So all of their employees are given access to a Bluecrest health check. 2 of their employees last year were detected for having cancer. No symptoms, no signs, nothing that would have indicated they had any ill health. They didn't have fatigue, they didn't have any concerns. If they hadn't gone through that assessment, they would not be with us today. And that's the value that Specsavers see in the programme we provide for them. So it speaks for itself. Martin, over to you.
So what we've done here is we've taken our clients who've come through their health assessment, and then we've paired them up with a health and wellbeing coach. And as part of that process, we survey them to see actually what difference did the whole process make. And what we find is that this is the answers as to what people actually commit to doing once they've gone through that process. So you can see that 39% of them said that they would lose weight. Nearly the same amount would exercise more. Around a third would adopt a healthier diet. 41% would take the results that we'd given them and see their own GP. So we can see that actually, particularly the combination of the two, is a really powerful motivating force to try and prevent illnesses before they start.
So what do you need to bear in mind? And we know that when the biggest issue that most organisations have today, especially in the current climate with the cost of living crisis, is first and foremost is cost. And that's one of the things that we feel really proud about, is our solution is very, very affordable. And it means that you can provide a whole workforce solution to your teams. So that's one of the key considerations. The other thing that our customers often consider is, okay, convenience. So if we've got people that are working all over the UK, can you support that? The answer is yes, yes we can. We run clinics within 20 minutes of most people's homes. We now run a 7-day-a-week operation. We start some of our clinics at 7 o'clock in the morning and we end some of our clinics at 9 o'clock at night. So that means for those people that want to come to have their health assessment outside of working hours, they can, but equally we'll also come on site and do health awareness days with you on site and run our health assessments on site as well. So that convenience point is really, really powerful. The third one is trust. People need to know that the information they're getting is something that's meaningful, it's well researched, it's well evidenced. But equally, the organisation you're working with is trusted. Our NPS scores speak for themselves. Our NPS scores are regularly over 60. So we know that people really value the difference that we make. And what we do is simple in terms of what we provide people with in terms of information. And then finally, the really important one is equity. This shouldn't be a benefit that's offered to just the C-suite, and often it is. Frankly, yes, they're really important. Of course, they're the people that make the decision. But the people that actually make a difference in your business day to day is it's not just on the chief exec. You can't do it on your own. You need to have a team around you that's living well, is well supported and able to make the decisions that are right by them and the business you in terms of looking after themselves. So really, really important. And our survey told us that these things were important. So 56% of our respondents suggested they'd be more likely to have a health assessment if it was a benefit that was provided by their organisation. But on the flip side of that, 44% of people said that they would pay for it themselves if it was affordable. And some of the organisations we work with do a partial payment, so they make a financial contribution. And that means that some organisations, for example, might say, well, we'll contribute X, and as an employee, you contribute Y. And from that, we see a lot of collaboration around how organisations make this accessible. Convenience, that's a small case study from the Coal Authority. They operate nationwide, so having access to our clinics nationwide was really important to them. I've already talked about trust and I've already talked about health equity, but this is important because it has to be something that is accessible to everyone, and it's important that you make a difference to your whole workforce. That drives engagement, that drives lower sickness levels. That means that you're not spending your time having conversations that you shouldn't be having around absence that actually could have been avoided. That's just a little case study there at the end. And Martin, I'll let you summarise if that's okay.
So just in conclusion, we believe at Bluecrest that proactive health assessments make a really big difference to people. You can identify the underlying causes of problems. You can make a massive difference in your employees' lives, and they will thank you for it. We'd love you to visit our stand. We're here today. You can pick up a copy of our white paper. Thank you very much for listening to us, and if you've got any questions and there's time, we'd happily take them.
Thank you very much. There is time for a couple of questions. I haven't got any up on Slido, but I'd like to ask, do you find that it's just the worried well that use your services, or do you have success in engaging those who might not bother much about their health otherwise?
No, definitely not. It's a combination. So I think there is a perception that it's often the worried well that prioritise coming for a health assessment, but that's not necessarily true. And actually, whilst we work alongside lots of organisations, we have a big B2C audience as well. And those individuals are often average age of around 68. So these are people that actually, and what we also know is that from the age of about 40 for women, and it's more like 50, 55 for men, that's when we start to really worry about, are we going to live well for the rest of our lives? And that's when we start to really take care of understanding what's going on inside of our bodies. So quite often our customers would tell us that these health checks are really important in order that they can just make sure they're staying on track of things. So no, it's a combination.
Okay, that's brilliant. Thank you. And how would you advise employers to try and engage their people in this?
So one of the things we can do is provide, I think there's a question about quantifying return on health investments. We can provide MI. So with consent from your employees, we can aggregate the data. So when you do a kind of first run, if you like, of your health assessments, we can say, right, what does that data tell you about your workforce? And then you can put some wellbeing strategies in place around that. Then a year later, or whatever cadence you want to do it on, you can then have a look at, so now we've put all of these measures in place. What has that done to either sickness absence, if that's what you want to measure? What has it done to happiness? And I think the next speakers are going to talk about the tangible difference engagement makes, all those kinds of things. So it does make a difference if you can look at the data and work that alongside. And also, Martin, who is, as you know, is our CMO, we would quite often happily collaborate with you on doing some webinars and wellness sessions with your teams around tangibly what you could be physically doing to make a difference. What is the overlap between health literacy and health? Do you know, that's a really important, that's a really interesting question, because I was only talking to my head of governance around health literacy, and what is quite concerning is the average reading age of the population in this country, I think, is average age 9. So when we are talking to our customers about what does that specific test tell you, the way that you articulate that and the language you use is really important. So we have to break it down to make it really easy for people to understand. So it's a really important question. So whoever asked that, thank you. Come and grab me, because it's quite an interesting one.
Okay, 30 seconds. Do you want to take the last question? What proportion?
I don't know the answer to that, actually.
That's all right. I don't think I know the absolute answer to that. So it depends on whether you have that as part of your package. So not all of our corporate customers have health and wellbeing coaching as part of it, but some do. Those that do, the uptake is really high. So only last week we were looking at the analysis of those health, what the health and wellbeing coach does in terms of tangible difference. But yeah, to give you the absolute accurate answer to that, drop us a line and we'll happily make sure we give you the right answer.
Well, thank you so much. That's been really informative. And please join me in thanking
Thank you.
Bluecrest for coming along. And